Artificial intelligence, or AI, is coming into more and more areas of our life, everything from driving to law enforcement, on and on and on. You know the list, but you may not be familiar with the changes it is bringing to the field of healthcare. Yes, healthcare. With us to talk about this new frontier is our tech guy, Rich Brooks from Flight New Media. Thanks for coming in, Rich. Good to have you here.
Good to be here.
So, is this for real? What's happening here? Is this something that is really being seen today? Is healthcare actually making changes that we're seeing already in healthcare?
Already today. In fact, just this morning, I got an email from the Harvard Business Review, and they were talking about physician burnout and how AI was actually helping with this. They were saying that physicians spend more than half of their day doing administrative tasks right now, which can be eliminated or reduced greatly by AI. There's something called ambient documentation. So with your permission, the doctor can actually let AI listen in and act as a medical scribe in real time, so nothing is lost. Another thing is autonomous coding. So we right now have a shortage in this country of medical coders. AI can step in and handle these thousands of different coding that are usually used for billing, freeing up even more time. So it really is a great way of reducing all healthcare providers' burnout while providing great improved care to patients.
Those are interesting examples, but the question that patients, that all of us are going to ask always is, how does AI compare to the actual doctor, seeing a human doctor?
Right, and sadly, perhaps, when they've done research across all different disciplines, when it comes to diagnosing conditions, AI either equals or outperforms doctors time and time again. And this has been really well documented in the Journal of American Medical Association. There's just like doctors are missing some of the things that the AI is not. And you might say, okay, fine, but like, how about that bedside manner? Well, they did this research where they had medical professionals read the answers from real patients' questions to both doctors and AI. The medical professionals did not know who answered what. 79% of the time, they said AI did a better job of answering the patient's questions, providing recommendations, and this is hard to hear, but providing more empathy and better bedside manner.
That is hard to hear, but not altogether shocking, as anyone who's made numerous visits knows, to the doctor's office. All right, obviously the future is not all golden here, so what are some of the concerns about seeing more and more of AI in our healthcare system?
And that's a great question, because there are downsides, and one big one is bias. And all of these AI tools are being trained on data sets from what's come before. Well, unfortunately, in this country, we have spent a lot more time treating and researching white patients than patients of color. So very often the data sets are misleading when it comes to these marginalized groups. That can lead to terrible outcomes. Another one is hallucinations. So, that's kind of the fancy term for when AI just makes things up. You can laugh at some of the examples that you might see out there, but it's not so funny when we're coming to life and death situations. And then there's also this thing called data set poisoning, which is basically a cyber attack. When people inject bad data into these training data sets, which will lead to AI providing really bad recommendations and outcomes. So those are some real concerns that need human oversight and intervention.
Obviously, we're in the really early innings, maybe the top half of the first inning as far as AI coming into healthcare. So it's hard to make predictions, but when you look out, try to look out into the future, where do you maybe see this all going?
Well, because of these issues with healthcare provider burnout, and there's also a lot of evidence that shows that patients are getting their recommendations and referrals faster when AI is implemented, and then the huge cost savings that the healthcare providers can get from this, they're only going to implement it even more. And I think we're just going to see more and more of this. And I know that can be frightening, but I think there's a lot of upsides to this. Like if we can reduce this burnout, and if we can provide better care and recommendations for patients, especially in an overtaxed healthcare environment, I think that we're just going to see better health outcomes for all Americans and people around the world.
Better outcomes at lower costs. That would be a beautiful thing.
Absolutely.
All right, that's the last word. Thank you so much, Rich, as always. We appreciate it. Rich has provided us with a bunch of links that provide more information into this topic. You'll find those in the 207 section of our News Center main app or website. More information on his company, Flight New Media, as well. Stick around. Back with more in a moment.